Okay, so next up on our educated consumer checklist is how do we respond when they say, I need to focus on my depression? Now, this one can be a little complicated because as opposed to being a case of flat-out denial like some of the other items on this checklist, this one can sometimes have some validity to it. But if you do happen to be dealing with a situation like this, here's where you're going to be able to cash in your chips as far as being an educated consumer. Because the response to this has to do with understanding the implications of having a substance use disorder diagnosis when you also have a co-occurring mental health diagnosis. So, for a great illustration of how to deal with this one, let me tell you a story about a family I've been working with for the past couple of years. They have a 19-year-old son who's had a long history of depression, but then they started having me work with him when his substance use became an issue for him. Now, the parents had already been doing RehabWorks as a result of me working with their younger son prior to the 19-year-old coming to me. So when the 19-year-old wasn't complying with the outpatient treatment I was providing, the parents set boundaries and he chose to move out rather than continuing to accept their help and go to residential treatment. And true to the progressive nature of his condition, his drug use eventually got him to the place where he was out of options and he needed his parents' support again. And so he agreed to go to drug treatment. But the whole time he was still, I need to focus on my depression. But the parents, being educated consumers, understood that substance use disorder is considered a primary condition, which means that to effectively address his depression, the substance use disorder needs to be arrested. In other words, it doesn't make any sense to treat his depression while he continues to use. And so every time he'd say, I need to focus on my depression, they would just say, you need to be in recovery from your substance use disorder. And they weren't discounting the need to address the depression, they just understood that that was part of drug treatment. Clients are seen by psychiatrists in substance use treatment programs, at least most residential programs, and it's really typical to treat substance use disorder and depression as co-occurring conditions. And I'll say that as a result of those parents having a clear understanding of this, in addition to already having some good experience with setting boundaries, that client ended up doing really well, and he's become what you would call a treatment success story. And so the point that I want to make here is that no progress was made while he was focusing on his depression, and in the meantime, his substance use disorder continued to progress. And to his parents' credit, by learning how to develop an effective response to the complex situation of dealing with co-occurring disorders, they avoided getting pulled off track, and ultimately they were able to shorten the distance between going from denial to successful recovery. And while I was coaching them through all that, I just kept saying, Video 6, Module 1. Keep watching it over and over, show it to him. Ask him what part he doesn't understand about the primary condition in co-occurring disorders. And so that's the video we're going to look at now. The answer ends up being pretty short and simple. Primary condition, co-occurring disorders. Video 6, Module 1.